When you have a rare terminal illness, knowing what to expect can bring some peace. In this video, I'm going to talk about certain terminal illnesses and what to expect during the last phases of those illnesses. Now, this is a very generalized video, so even if I mention specific diseases, I am talking about the end of those diseases very generally. Some diseases that I don't see often on hospice but come to mind are diseases like MS, pulmonary fibrosis, and Ehlers-Danlos syndrome. Now, in this video, I'm not just talking about those diseases. Any kind of chronic life-limiting illness will take on somewhat of the same things, meaning they'll be up and down. The disease is like a wave, You have months, maybe even years where you're feeling okay. And then something happens, boom, you're down, right? You might have to be hospitalized. Then you're hospitalized for a long time, which you lose a lot of strength, a lot of things. And then you get out and you start coming back up and you might start living your life again, right? So any kind of chronic life-limiting illness where the progression is sometimes slow, you have these dips where you might be hospitalized and you think this might be it. Right? And then it's not. And then you get out and then you kind of maintain, something else happens, right? So it's this long, drawn out, hard process. If anyone has these diseases or something like that and you're listening to this, you know what I mean, right? You know what I mean. And I think it's a very personal decision on when you stop going to the hospital. When is enough enough? When do you get placed on hospice? And a lot of people with these diseases who do go on hospice, many times come off hospice because they're on it for 6 months, maybe a year, and then they're doing pretty well. So they end up coming off hospice. So it just depends. It's a personal thing. But here's what I've generally seen with the progression of these diseases and what they look like once they eventually come on hospice. I will say when someone has a chronic life-limiting illness that they're finally at the very, very end and they feel like, you know what, we're at the end, I want to go on hospice, or a doctor says you should go on hospice or you need to go on hospice. Sometimes it can be complicated, right? Because they've had this disease for a very long time. They know how to manage it. They know what they need, right? And now you're coming into a hospice company. We are used to doing kind of usually very minimally because most people coming on hospice just have pain or just have this. But someone with chronic life-limiting illness has a lot of issues usually, and a lot of medications that they need or have been using to help manage symptoms. So there's a lot of work that needs to be done between the patient, their provider, and the new hospice provider and this company over here. So it can take a little more time to get onto hospice, to get things regulated, to get things kind of neutralized. That's the first thing I see. Again, a lot of these patients too can be on hospice for a long period of time and sometimes even come off hospice. While they're on hospice, they can be up and down, right? Good days and bad days. Some days the meds work. Some days they feel better than others. Some days they feel like, why the heck am I in hospice? Then the next day, I feel awful, right? So it's a lot of up and down. I think too, generally speaking, of course, patients who have had chronic life-limiting or terminal illnesses for a long time, they're used to treating the things, right? Something happens, we go to the hospital, we treat it. Sometimes they're in the hospital for a month, right? Because there's a lot of things going on. But when you're on hospice and you're really getting towards the end, it's up to you to decide, okay, never mind. We're not going to treat this infection. I know if I go to the hospital, they might be able to treat it. Maybe I'll end up being in the hospital for a month. Maybe I'll come back out. Sometimes people do get to the end and they go, I don't want to do that anymore. I don't want to treat the infection. I'm just going to stay here on hospice and be comfortable. And they may die because of this infection, because that is what they choose, because they are done, quote unquote, fighting, hate that word, but fighting this disease, right? And nothing is wrong with that. Sometimes that is the end of the disease. You see something where you're no longer going to treat it. I don't want to, or it'll be too hard to. I'm too weak to go into the hospital to try this, right? So you don't. Or you just try oral antibiotics and maybe that will work, but maybe it doesn't. So a lot of times it can look like that. The person and their family kind of making a choice not to treat something or not wanting to treat it because they want to stay home. They value staying home over going to the hospital to treat the thing. And just like anybody else dying on hospice, you're going to see the same things, just like you've been seeing. You're not eating and drinking as much. You're sleeping all the time. Specifically, when you start getting towards the last few weeks of life, you'll see it a lot more. You're sleeping more than you are awake. You're eating very, very little. And then your body goes into what everyone's does, right? You're sleeping all the time. You're in that transitional phase, getting close to actively dying phase. That part's not different just because you're dying of some kind of like life-limiting chronic illness. That's the same. And if anything, your symptoms will be less because your body is getting so close to death that it kind of starts shutting down and you're more unconscious. You're not eating and drinking. You don't need as much. You're not taking your medications, and you'll go into the actively dying process just like anyone else would. A lot of times at the end of life with chronic life-limiting illnesses, dementia, Alzheimer's, COPD, CHF, pulmonary fibrosis, MS, different chronic diseases that are more rare, but they still can be on hospice, you will have less symptoms sometimes at the end of life because your body is basically fully shutting down and really taking care of itself. And the less you mess with that, the better it will usually go. So the closer you are to death, with any disease, the more common it's going to look. Almost everybody, no matter what disease, at the very, very end during the actively dying phase will look the same. They'll be unconscious. They're not eating and drinking. You'll have changes in breathing, changes in skin color. All of those things will not be hurting you because it's a natural part and the body's doing it for you. The body is biologically built to die and is helping you do it. So no matter what the disease, when you're getting towards the end, almost everyone actively dying will look the same and not need much. I think anyone with a rare chronic terminal illness, the biggest thing you can do, the best thing you can do for yourself and for your family is to plan, is to have an idea of when you think enough is enough, or have an idea about how your disease progresses. Talk to the doctor who's an expert in this disease and talk to them about what does the end of life look like. Ask yourself, do you want to die in a hospital? Do you want to die at home? And if you do want to die at home, ask your doctor who's an expert in this disease how you can make that happen. When to stop going to the hospital so you can die at home. When to know when to go on hospice. And sometimes there's not black and white answers. There's really not. But I think even just having that conversation and knowing that there's an open dialogue between you and your provider, the person who knows this disease very well and knows you very well, that will help you and them kind of plan as this progresses. At the end of the day, I think knowledge is power. I hope this helps. You guys, I'm excited to announce that my journal is officially out, the Nothing to Fear journal. It's an easy how-to plan for the end of life. And it goes with my book. So if you're on my book and you're thinking, now what, Julie? This is now what? The Nothing to Fear journal, an easy guide to help you plan for the end of life. If you're interested, you can get it at hospicenursejulie.com or just click the link in the description.
Oh my God! Okay, it's happening. Everybody stay calm.
What's the procedure, everyone? What's the procedure?
Stay calm!
Wait.
Everybody calm down!